So a very good evening to one and all. On behalf of Ayurveda, and we have the most eminent faculties for dealing with each and every departments. So today we have management of anorectal disorders in OP level, and we have the best speaker available now. That is Dr. Ravi Shankar Parvaje sir. When speaking about him, I am proud to say that he is the chief physician and surgeon at Sushruta Ayurveda Hospital at Puttur, and he has developed the Pratisaraniya Kshara Karma and Agni Karma in different conditions like piles, fistula, nano fissures, rectal prolapse, etc. And he has presented n number of papers and conducted workshops on Kshara Karma and Agni Karma in piles at various platforms. And he has also published n number of research works on Kshara Karma and Agni Karma. So, without much delay, I invite you, sir, for today's session. Over to you, sir. Sir, you have muted the your headphones, I guess.
Okay.
Yes, sir. Yes.
Am I audible now?
Yes, sir. You are audible.
Okay. Thank you very much. Thank you.
Okay.
Yes. So first of all, I'm thankful the organizers for giving this opportunity to share my experience of treating anorectal diseases in the OP level. So first, let us have uh, the blessings of Guru and God. Guru Brahma, Guru Vishnu, Guru Deva Maheshwara, Guru Sakshat Parabrahma, Tasmai Shri Gurave Namaha. Om Namo Bhagavate Vasudevaya Dhanvantaraye, Amrita Kalashastaye, Savame Anashanaye, Trailokyanathaye, Vishnave Swaha. With the blessings of all Purva Vidyas and Apurva Vidyas, I will start my presentation. OP level management of anorectal disorders. So for Arshas, especially in anorectal disorder, mainly you get Arshas. It has 4 types of treatment modalities is told: Veshaja, Kshara, Agni, and Shastra. For each treatment, there is a specific indications are there. When what should be done? If it is when Veshaja should be done is when Achira Kala Jatani Alpha Dosha Lingopadrava. He recently originated and Alpha Dosha Linga Upadrava are there. Such cases only you have to do Vesha Chikitsa. If it is very big, Tanumula Uchranta, that is 4th degree piles, when there is a narrow pedicle is there, Shastra Karma should be done, or Kshara Sutrena Badhva. Chatra Kara Urdu Vistran, Kshara Sutrena Badhva. These are surgical management. And Kshara Karma is a parasurgical management when Mrudu Prasruta Avagada, a Mrudu and Avagada and Prasruta, extensive situated. A narrow pedicle you do Shastra, if extensive situated then do the Kshara Karma. But a Raktaja and Pittaja, so Sravya, so Kshara Karma should be done. When it is a Ruksha Arshas, Karkasha, Sthira, Prutu, Kashinani, a hard one, then go for Agni Karma. This is for Agni Karma. Agni Karma Yantra, you can use a pottery machine also. Anything you can use for Agni Karma. Only thing is by heat it should be cut. It is by Kshara you are doing the Kshara Karma. By Agni you are doing the Agni Karma. So that is specific indication when we should do what. Now coming to in a OP level, when you are sitting this all surgical management anyhow expertise is needed. The general practitioner, so they are sitting in the OPD, how they should manage all the conditions of anorectal disorders. When they come to you in the clinic, when there is a bleeding with the pain or without pain, and when there is a mass, in the anal region. Most of the patient comes to the doctor to consult. This is the condition I am having. You should diagnose and give the treatment. They will not be knowing why it happens. They comes with the linga, signs and symptoms. We have to find out why it has happened. Here to see why these symptoms have happened. Then Aushadhi should be given. Hetu, Linga, Aushadha, Jnanam, Swasthatra, Parayam. This is what Charaka said in first chapter itself. It's a common thing any physician should do. Patient comes with all signs and symptoms. We have to find out its Hetu. So that we have to give Aushadha. So one by one the different signs and symptoms how they present to us in a clinic. And by what are reasons it can happen. We will discuss these things, how it should be. It can be treated in the OPD level or when it should be referred to a surgeon or physician for a expert opinion. This I think can be done in the OPD level. So patient coming with the bleeding, with the pain, then what are the conditions? So number one is the fissure in anus. Second one is the fistula in anus. And thrombosed bile mass and malignant conditions. Then when bleeding is there with the pain, then bleeding without pain, when they come, if you find out, usually it may occur due to hemorrhoids, internal hemorrhoids, or Crohn's disease, ulcerative colitis, and in malignancy also. Sometimes may be pain, may not be pain. All these conditions, they come to us. So when this is there, what physician should do, he should see the rectal examination should do. He can diagnose it. What is it? Is it hemorrhoids? Is it Crohn's disease? Or if it is a Crohn's or ulcerative, you can have expert opinion afterwards. So if it is fistula or fissure, you can see a thrombosed bile mass. You can see in a clinic. Definitely you can treat. If it is a malignancy, you can refer. Just you put your finger in the anal canal, you can find out many of the things. So rectal examination, I think every clinician in OPD they can do it. I don't think any physician should hesitate to do rectal examination. So mass per rectum conditions. If a patient, one is bleeding, second one mass per rectum. That also with the pain, without pain. These two things will be there. This also we can diagnose. So when mass per rectum is there with the pain, what are the conditions? One is thrombosed bile mass. Usually most of patients will have thrombosed bile mass. A malignant condition. A fistula abscess. Fistulous abscess. That's all mass per rectum. Or a sentinel tag with the fissure in it. So these are the conditions when there is a mass per rectum is there. Mass per rectum, but without pain. What are the conditions you can have? One is rectal prolapse, a malignancy, not a hemorrhoids. Patient has a mass. When you see a rectal examination, by seeing itself, you can see there is a rectal mass prolapse may be there, a hemorrhoids prolapse may be there, a third degree hemorrhoids or fourth degree, or a malignant condition, mass. Or with the pain, there may be fissure. Usually with the pain mass, there will be usually fissure. And another thing, thrombosed bile mass and fistulous abscess. These are all you can see. No other symptoms, only these symptoms. You can diagnose and do the specific treatment. So internal bile mass. This is what from outside you can see. Patient comes. When internal bile mass is there, how it should be done? To see what happens in the internal bile mass. Hemorrhoidal vein is here, you can see in the picture, which is engorged. That is so slowly engorged, the patient will have internal bile. When this external mass, it is engorged, you will have external bile. Okay, this you can see in a rectal exam, first you can see it, or in a proctoscopy examination, so you can see this condition. So below dentate line there will be external bile mass. Above dentate line, internally dentate line, there will be internal bile. You can diagnose it where it is, like that you can diagnose. When this area below dentate line, it is highly painful area. A fissure is there, this is always below dentate line. But above dentate line, it is a painless area. This is the specific condition in the anal canal. External pile mass, I already told, the external mass. This is engorged, there will be external pile. If it is thrombosed, there will be severe pain to the patient. So internal thrombosed pile mass. When this pile mass, it is thrombosed. That means clots are happening inside the pile mass. Patient, a painful mass will be there. They're coming out with the bluish black color. You can see. When it is inflamed and if it is infected, patient will have very severe pain. So patient may not pass these stools, all these conditions. Just give him a sitz bath, they will recover. So these are the conditions you can. External thrombosed pile mass. This mass may, this external mass, this may be thrombosed with the only pile mass painless. If it is thrombosed, then it will become painful because mass of the pile mass pressuring on the nerve endings, there will be severe pain to the patient. So when such a condition is there, how you should treat this treatment also I will explain here. See, only internal hemorrhoids is there, only internal pile mass is there. When a patient comes to you with internal pile mass, there will be, in a first stage, there will be bleeding. Only bleeding will be there. No pain, only bleeding will be there. Raktapittava chikitsa. Simple hai, Raktapittava chikitsa. Just you give Ushirasava, Kamadavit Mukta, Gandhakarasayana. If constipation is there, give Haritaki or Vishwanarachur or Avipatti Kartu. If there is no constipation, just you give Gandhakarasayana, Haritaki and Kamadavit Mukta with the Ushirasava. If there is a slight loose motion is there with the bleeding, then give Kutaja Ganavati along with this drug. In a internal hemorrhage, there is no bleeding. There is a bleeding, but internal hemorrhoids, but there is no pain. When the external pile mass is there, just external pile mass comes to you in a clinic with a mass. Actually, no need of any medicine. Usually Haritaki is sufficient, but this external pile mass cannot be removed by medicine, only external pile mass without pain. If internal hemorrhoids is thrombosed, if blood is clotted, patient comes with severe pain. Then the treatment is, along with the Gandhakarasayana, Triphalagugulu and Haritaki, give sitz bath, apply oil. You can apply Jate Tela or Sarivai Tela, Madhuragana Tela, and give him hot sitz bath with the Saindavalamada, mixed with Saindavalamada, hot sitz bath. So that thrombosis will reduce and his pain will go. If there is a constipation, stool is hard, stool looseners like Haritaki or Herbalex or Isabgol, these things should be given. If there is a loose motion, you give him Kutaja Ganavati. So this change should be there. And Abhaya Aresta can be, if hard stool is there, give Abhaya Aresta. This is the drug of choice in such a condition. When there is a thrombosed internal pile. When thrombosed external pile mass is there, patient comes with the severe pain to you near clinic. A mass with the severe pain. It's a very simple condition. One thing you can do, Prachanna. Grathita Rakta should be done Prachanna. Take a small injection, just prick it, clot will come out. This can be done in OPD level. If you are afraid of it, just you give him apply Jate Tena for application, give him sitz bath or sitz bath. The thrombosis will be slowly dissolves by 5 days. By 5 days it will reduce, the pain, swelling, everything will reduce. For 1 month if it continues, it will go. The internal medicine is Gandhakarasayana, Triphalagugulu, Haritaki. That is such. Gandhaka Rasayana, Triphala Gugulu Harite. If a for a external hemorrhoid 5 mass. Then coming to, I think I have told, if a hard stool is there, definitely you have to give Abhaya Arishta in all these conditions. Abhaya Arishta or Vaipatikara Churna, these things. So, some stool looseners that should be given according to presentation. Then coming to fistulous abscess, what happens? See, here abscess can happen in different place, in a sacrorectal place or perianal space. When in sacrorectal space there is a abscess, the abscess patient may have fever, swelling, all these things, but the patient will not have that much severe pain. If abscess occurs in the perianal area, it is very severe painful swelling, very severe painful swelling. The treatment of choice should be I&D, incision drainage should be done. First should be removed. That is the treatment. If in your OPD just you put a needle, then you can remove the pus. That also can be done. Initial state. Simply just to put a needle, pus comes out. Patient can get relief immediately. Even Sitsubat, Gandhaka Rasayana, Triphala Gugula. That is Vidrati Chikitsa should be done. Asanadi Ganakashaya or Varunadi Ganakashaya, Negrodadi Ganakashaya for drinking. Gandhaka Rasayana, Triphala Gugulu or Gugulu Dikta Kashaya. These things can be given. That's a Vidrati Chikitsa should be done. Or if it is, if any in OPD level, if you feel it is difficult, you can refer to a Shalya Chikitsa for further management. If fistula occurs, this is about abscess, what I have said. Because as a practitioners, when you practice in the peripheral area, initially any patient comes to his family physician. Definitely they come with this state. But once it is abscess ruptured or if you open it, that may end up with the fistula in there. No? These are many different types of fistulas can be done. It should be treated with Kshara Sutra treatment. One thing is should be treated with the Kshara Sutra Chikitsa. Or you can have some, if it is complicated, we have different methodology of Kshara Sutra Chikitsa. If that technique is there, we utilize laser Agni Karma or Kshara Karma. Many methodology we do for a simpler way of treatment, say permanent relief. Kshara Sutra Chikitsa is the drug of treatment of choice, what Sushruta said. It's a different abscess according to abscess extension into retrorectal area or above the levator ani muscle or intersphincteric area or ischiorectal area, or different types of fistula you can have, transsphincteric or suprasphincteric or intersphincteric, like that, different low anal, high anal, complicated, different types of fistulas will be there. Like that, the different methodology of treatment will be adopted. Such condition. Anyhow, this Chikitsa is not for the OP level practice. It needs some expertise. Coming to fissure in nerve, why this fissure in nerve occurs? It's a very interesting thing. Is here we should have slight knowledge of anatomy here. But say this is a dentate line. I am showing you a dentate line here. Below dentate line, it is very severe painful area, sensitive area. Above dentate line, it is insensitive area. Here, this is a round muscle of the intestine. This extends up to here. See, below dentate line, circular muscle of the intestine extends. This is known as internal sphincter. This is a involuntary muscle. It is not under our control. Whereas this is a external sphincters. This is under our control. Here external sphincter is there. Here external sphincter is there. This levator ani muscle, conjoint muscle is there. Now here the very interesting thing is that when this area, any rupture occurs or a ulcer occurs, any injury occurs in this area, what happens? This internal sphincter spasm occurs. Internal sphincter spasm occurs. When the internal sphincter spasm occurs, patient will have very severe pain. He could not pass the stool. And why it is pain is it is sensitive area. In a sensitive area, involuntary muscle spasm occurs. This is voluntary muscle. You can relax yourself. It is in your control, but it is not in your control. But its spasm occurs without your control. So whenever next stool comes, next stool accumulates here. Usually you can relax your external muscles, external sphincter muscles with yourself, but it will not relax at all. Which one? Internal sphincter. Naturally, when in a sensitive area, if it is insensitive, no problem. If it is a sensitive area, internal sphincter, a involuntary muscle is there. It's involuntarily, it is not under your control, it spasm occurs. Patient will have very severe pain. Again and again, it will spasm occurs. When next stool comes, your anal canal is not allowed to open. Even though you relax your external muscle, this internal muscle, intersphincter, will not allow it to open. When it is not allowed, when you force your stools from outside, there will be rupture of the anal skin. Naturally, there will be fissure occurs. Fissure is ulcer occurs. When next stool comes, it is a painful. It's a vicious cycle continues. So actually, in this area, what we say is one is apanavayu and vyanavayu. Apanavayu work is moving everything to outside. Vyanavayu work is having muscle spasm occurs. Prasarana akunchana is work of vyanavayu. When akunchana of vyanavayu occurs, when prasarana of vyanavayu occurs, pravahana should be done by apanavayu. But when pravahana occurs, if vyanavayu does not allow it to prasarana, only akunchana is forcefully occurs, naturally there will be rupture of the skin. That is known as Vyanavrta apana. When Vyanavrta apana occurs, you will have Vami Atmana Udavarta Gulma Arti Parikartikaha. This Parikartikavat Vata Vedana occurs, severe pain in this area. Vami Atmana Udavarta Gulma Arti Parikartikaha. Severe pain in this area occurs. Parikartika means Basti Gudamedrayoho Parikrantanavat Vata Vedana. Parikrantanavat Vata Vedana. Very severe pain occurs in this area. That is known as fissure in anus. It can occur only without hard stool also it can occur. With the hard stool also it can occur. When a rupture occurs, there will be fissure. Naturally, that is nothing but a abhigata, Vrana. Initially, Runashotha occurs and Runa occurs. Then it becomes Dushta Runa, leading to sentinel tag. So when repeated this fissure occurs, there will be sentinel tag comes out. Let's say Runa Granthi, it's known as Runa Granthi. It will occur. Runa Granthi. Runa Granthi is a Dushta Runa. So, how is it? The Parikartika means Shakritaya Samsushtam Atisarya Shunita Pak Paschadva Pari Purishasya Sarupa Sa Parikartikaha. Before or after defecation, there will be bleeding. And Parikantanavat Vata Vedana. Sarupa Sa Parikartikaha. Parikartika means Basti Gudamedrayoho Vata Vedana. It occurs in the anal canal. So, another thing, it can occur by Varchasati Bandha. Very hard stool also can cause Parikartanavat Vata Vedana. Severe pain can occur. So, here, it's a very interesting another point what I like to. One is injury to anal canal. By hard stool it can occur, or by blockage of movement of vayu also, Varchasati Bandha, it can occur. But it can occur even with the Atisara, Virechana Padra, Basti Padra also it can occur. Why it should occur in Atisara, Virechana? Well, already a hard stool anyone can understand. There will be injury. But why in a loose motion also it occurs? This question arises. So what he says, it is a Vata Prakopa should occur. By Vyanavartama there should be Vata Prakopa should occur. Vata Prakopa, how it can Vata Prakopa occurs? Always Vata Prakopa is Dhatukshaya Kopo Marutasya Avaranena. Whereas in injury and hard stool is a Avaranat Vata Prakopa, then Atisara Virechana Basti Dhatukshayat Vata Prakopa will be there. Dhatukshayat Vata leading to Vyanavrtapana, you will have severe pain. Spasmodic pain will be there for the Vata Vedana. Whereas in Abhigata, there will be Raktavarana, Vata Prakopa, leading to Runa. and Runashotha Lakta. So in this area, Apana Vayu and Vyana Vayu will be there. When Vyana or Apana, you will have Homeatma Udar, Gulmarti Parigar, Lingam, Vyana or Apani, Vyana or Apana leading to Parikantanavat, Vata Vedana. To this happen, there should be Vata Prakopa. A precursor for a Vyana or Apana, there should be Vata Prakopa. Vata Prakopa can occur due to Raktavarana or Dhatukshaya Vata Vritti. So Raktavarana can occur by Raktadushti by Abhigata or Ahara Vihara or Vachasati Bandha by hard stool also it can happen. So by all these means Avaranath and Dhatukshaya that will be for example Vata Vedana. So treatment protocol usually we do is Snigdha Anulomana for Vyana or Tapana, whereas Rakta Prathana, Rakta Dushti, Runa Chikitsa for a Runa will be Runa Chikitsa should be done. And Agni Karma is told, why Agni Karma is told? You see, Vayu Uchrita Katina Sukta Mamse Rune, Atyugra Ruja Vayu, Uchrita Katina Sukta Mamse Rune, Uchrita Mamsa, and when Sukta Runa is there, such a condition he says you should do Agni Karma. This is nothing but a Runa Granthi, what Ashtanga Hridaya says. See, this is the condition you can see here. I think this video is not working. Here Runa is there, but the Supta Runa will be there and Uchrita Mamsa. That is sentinel tag with the fissure in N. The treatment is Snigdha Anulomana and Agni Karma. So if it is Agni Karma is a surgical procedure, may not be, it's difficult to be done in a OPD level. But all other treatments, these treatments can be done with a OPD level. One is Snigdha Anulomana. That is why I say you give Erinda Taila with milk. Okay. Or Abhaya Arishta with the Grita. Or Shatavarya Grita with the milk. Snigdha Anulomana. Gulkund. Isabgul. Making a loose, stool loose. These are all things can be done. Okay. Snigdha Anulomana for Vyana or Tapan. Achangirya Grita. If it's Atishara, all these things, Upadra, having this one, you can use Changirya Grita. If it is hard stool or some injury, other things, you can use Shatavarya Grita or Abhayarishta with milk. These things can be done. And for a Runa Chikitsa, then the Krasana Trifala Gukulu. This is the best treatment. And always is a Pitta Sorva Raktushti, Abhigata, Ushmena, Pitta, Ruddhi will be there. So treatment choice is Kamaduta with Mukta, Mukta Vasma with the Kamaduta. This can be utilized, a drug of a choice. Kamaduta with Mukta, Gandakrasayana, Trifala Gukulu. And Abhayarishta, Shatavarya Grita, Gulkund. These are many drugs are there. You can select according to any physician can select. A treating physician can select all these drugs. Whatever drug needed, you can. So what is needed primarily? If it is hard stool, give make it loose. Number one. If it is Pitta Ruddhi is there, Vata Pitta Runa is there. So Pitta Hara Vata Anuromana, Kamra Mukta, Dandakrasayana, Trifalagugulu, and Harita. These drugs you give, and most important, give Snigdha Anulomana, and for a Runa, you give Runa Basti, or you can, or Runa Pichu, Thaila Basti, Runa Basti or Thaila Pichu. Apply oil, maybe Narikela Thaila also okay, or Jate Thaila okay, or Madhura Ganashaila, Esti Madhu Thaila, or Narayan Thaila, any Thaila. You apply in that area, give him Srishta bath. That's Ushnodaka Avagaha Sweda. Pitta Samsargaja Vata, you should give Ushnodaka Avagaha Sweda. If the Kapha Samsargaja, you give Tapas Sweda or Nadi Sweda, or Kevala Vata, you give Upana Sweda. When Pitta Samsargaja Vata, when since it is a fissure in all these things, a painful condition, Raktavarana Vata is there, Pitta Samsarga is there, give Ushnodaka Avagaha Sweda. That is hot sit bath. Tell him to sit in a hot water, warm water. That is self-sufficient. It's a, after doing Snigdha, applying Thaila, Rana Pichu or Rana Basti, Thaila Pichu, apply that, give him sits bath. Naturally, muscle spasm is relaxed. That is a Vyana Apana is relaxed. Vata, Hara occurs. Patient gets relief immediately. This is the treatment for fissure in I think this can be done in a OPD level. I think all the physicians, either physician should treat such conditions. Easily it can be treated. But once Rona Granthi happened, a sentinel tag happened, or if there is a sorry, there is sometimes what happens. So I will show in the picture. Sometimes in such patients, there will be a hypertrophy anal papilla. Anal papilla you are seeing here, in dentate line. This papilla may be engorged, like this engorged. Then this engorged hypertrophied anal papilla will not allow anal canal to dilate. Then there will be rupture happens. Rupture happens, fissure happens. So for that purpose, it should be removed. Yeah, unless you remove it, the patient will not get relief. Of course, it is a surgical treatment, should be removed by Agnikarma. Just treatment is Agnikarma. So engorgement can happen here, hypertrophy anal papilla, or a skin attack can happen here. That is a Runa Granthi. Uchrita Mamsa, Supta Runa inside and Uchrita Mamsa. Here it can happen. One is here, one is here. These two things, Uchrita Mamsa can happen, Supta Rana will be there. In both conditions, unless you remove this Uchrita Mamsa, this Supta Rana will not go. How many times you treat? But temporarily you can give relief, but permanently it will not go. So treatment is Pittahara Vatanuromana. Rakta Prasadana with Pittahara Vatanuromana. Chikitsa. Runa Chikitsa should be done. If surgically you do Agnikarma. This is the treatment of choice in such conditions. Then coming to next condition is rectal flaps. So, rectal flaps. In rectal flaps, what happens? You see, rectum is here. Usually, this rectum slowly can come out. In old age also, it can happen. In young age also, in babies also, it can happen. In babies, usually rectal flaps will be there. Why? Because this anal canal and rectum is in a straight line. So when they pass, usually it collapses. As the age increases, what I want to show, as age increases, slowly it will bend, one-sided bend. So rectum will not come naturally from outside. So by 12 to 16 years, naturally the straight line of this rectum and anal canal becomes slightly bent to one side. Slightly bent to one side. Here in the photo it is not there. Slightly bent to one side it will happen. Then naturally perhaps comes down. That is why when a patient comes, a baby comes with rectal flaps, just give assurance to the patient. By 12th year, this rectal flap slowly stops by itself. No need of any treatment. One thing you can give a drug is Harita. Drug of choice is Haritaki and Changyarergrita. If it's in adult age, if it comes after adult age, if still rectal flaps is there, you can go for Ksharakharma or you can do for rectopexy surgery. Say, 4th degree complete presidentia, you have to go for rectopexy surgery. It is a 3rd degree, 2nd degree and 1st degree. You can do by Ksharakharma, it can easily cure. If it is just a 1st degree, you can try with the Changyarergrita and Haritaki tablet, Haritaki Churna for a long term by 6 months. In OPD level, you can treat such cases. Patient will recover nicely. I think in rectal flaps, and another thing is in old age, after 60 years, the patient comes with the rectal flaps. In that age, rectal flaps is very difficult to cure. Even surgery also may not successful, but if a 4th degree, go for rectopexy surgery if possible, if patient is needed. Otherwise, as a palliative care, we can give Changyarergrita and Haritaki. But by Ksharakharma, you can't do with that age because as their age goes on, all muscle become relaxed, slowly perhaps completely occurs. And usually in ladies it occurs with the rectal prolapse and uterine prolapse together. Such conditions are very difficult. You can go for hysterectomy by vaginal hysterectomy and closing of the rectovexity surgeries should be done. I don't think such condition can be treated with medically in OPD level. As a palliative care, you can give Changira inside Haritaki and apply oil and give Sitsaban as a palliative. Such conditions, after 60 years, it's very difficult in a OPD level to cure. As a palliative only, we can give. Curative is difficult. In malignancy, it can occur anywhere in any malignancy in the rectum area. There will be secondary files can happen because of pressure of the malignant mass. There files can happen, so hemorrhoids can happen. Just you put your finger, you can feel the file mass inside. Then it should be confirmed with the biopsy and the colonoscopy. It will be confirmed. So why patient comes to you is such patients comes to you with mucus blood stool. We call it a slurry stool, slurry like stool, a loose stool with the blood and mucus. So always any patient comes to you initial stage with the loose stool with the mucus and blood. Always you suspect it may be a malignancy inside. If possible, put a finger into the anal canal. If it is a malignant mass in the lower area, you can feel it in your finger. If it is higher area, you can't feel. Better to refer for a colonoscopy to diagnose what it happens. Why I am saying, in that stage, if you miss out, because in OPD level, physicians practicing all over villages everywhere. Initially, this patient comes to such physicians, village level, all the like us, so we practice in a village level. They comes to us in initial stage. In that itself, that stage itself, if you diagnose it, if it is a malignancy, just you do the surgical. Shastra karma is first line of treatment. You should surgically excise it. You can cure the patient. Once if patient passes that stage, if mass develops into the serous layer or abdomen, there is a metastasis to liver, the patient's life is gone. It cannot be cured afterwards. When it is in initial stage, that itself is a service to the patient. So at that stage, if you diagnose it, immediately you can give him service. So you can refer for surgery. If you remove it in that state itself, it can be cured. That is why I stress for all the physicians, if patient comes with bleeding with the mucus loose stool, bleeding mixed with the mucus loose stool, that is slurry like stool, put your finger inside, you can feel the mass or do a colonoscopy, diagnose it. This is the usually it happens. And when there may be polyp also, another condition, tumors, benign tumor, what you can find out in anal canal is polyps. So such a polyp mass, it can occur in a small babies also. They come with the polyp with the bleeding. So easily it should be diagnosed and it should be excised immediately. If you excise it, surgical excise it, it can be cured. So by medicine it cannot be cured. And if it is a malignancy, what happens? It is a arbuda, ekadeshaja, and sannibhataja, and raktarbuda, a malignant tumors. So Chikitsa told in Sushruta is Shastra Karma is first line of treatment. Shastra Kshara Agnibeshaja. Always for Arbuda and Gulma, first line of treatment is Shastra Karma. If it is possible, you do the surgery in the first stage itself. First you diagnose it, immediately it should be done. If patient goes to next stage, metastasis happens, there is no point in surgery doing. You can do palliative care or immunotherapy. What Sushruta says, Rakshed Balam Chapi narasya nityam tadrakshitam vyadhibalam nihanti. Rakshet balam chapi narasya nityam. If you do rakshana of bala of the person, narasya nityam, tad rakshita bala, that increased bala, nihanti vyadhi bala, decrease vyadhi bala. It's immunotherapy. If you increase immune of the patient, that increase immune itself kills the vyadhi bala. Vyadhi can be killed. If they are malignant, especially this shloka is told by Sushruta in Arbuda Adhyaya. Very interesting. In Arbuda Adhyaya, he tells this shloka. So any Arbuda can be mitigated, or palliative care can be given, or his life can be extended with this treatment. This is nothing but Rasayana Chikitsa. In Rasayana Chikitsa, you see, first you do Sadhyomana Hadya Gesta Koshta Siddhi and start with Rasayana Chikitsa. This Rasayana Chikitsa again, if say bleeding is there or mass is there, if Kapha Pradhana, go for Ballata Kathaila, Kapha Hara Rasayana. If it is Pitta Pradhana, go for Tiktaka Rasayanas, any Tikta Rasayanas, Gugulu Tikta Gruta or Amalaki Rasayana. These Rasayanas, Pitta Hara Rasayanas can be adopted. So again, I think you should do, and other Rasaushadis, Rasamanikya is there, Swarna Basma Yogas are there, Hiraka Basma is there, many Rasayana Yogas are there. Or Gomutra Arka, when it's a Pitta Pradhana, Gomutra Arka may not be useful, or it can be given as a Panchagavya Gruta, drug of choice, Panchagavya Gruta. This can be utilized as a Rasayana. When you do Rasayana, Tad Rakshita Bala, his Bala of increased, naturally Vyadhi Bala can be decreased. So then hypertrophied anal, this already I have told, hypertrophied anal papilla. By that there will be fissure will be there usually. Or many patient comes with hypertrophy anal, there is some mass is there. Just if there is no symptom of a fissure, that's a painful bleeding, nothing is there, you can ignore it. If pain is there and bleeding is there, it should be removed with the surgery. So then comes the Crohn's disease and ulcerative colitis. These two conditions, I think last time in gastrointestinal tract I have discussed about this condition. It comes as a Raktatisara condition, nothing but Raktatisara. There will be ulcers, mucus, blood with the stool. Actually, ulcerative colitis, Crohn's disease, malignancy. In all three conditions, there will be a bloody stool. You can say stool with the blood, with the mucus. This mucus, stool, and blood. These three things are mixed. It goes all these three conditions: Crohn's, ulcerative colitis, and malignant condition. In all three conditions, you will have same presentation. It can be diagnosed only by colonoscopy and biopsy can be diagnosed. Once you diagnose it, the treatment, what I utilize it, in the Crohn's and ulcerative colitis, it is an autoimmune disorder. My drug of choice is, don't give him to take milk and curds. He should take only buttermilk. That is, takra should be taken as a diet. And spicy foods, spinach, these things he should avoid. Moong dal he should avoid. And give St. Madhu and Musta plain kashaya, without milk. Kashaya should be given continuously with the Shankavati or Kamadev Mukta or Gandhak Rasayana. These things all Borapurpati or Kutaja Ghanavati. Sorry. All these things, anything according to presentation, you select a drug and should be given. Sorry. I have treated plenty of cases of ulcerative colitis with this combination, St. Madhu and Musta. First, what I do is I give him a Sadhyomana and Sadhyo Virechana. If severe bleeding is there, go for ulceration is there, bleeding is there, go for Pichavasti first. By that, his ulcers are cured completely. Then continuously, if you avoid milk and moong dal, and if he takes takra anna as a staple diet and st madhu and musta plain kashaya, if he takes naturally by 6 months such conditions is being cured. That what I have seen. I think all the physicians can try this treatment. So with this presentation, I think I have finished all the presentations of the anorectal disorders in OP level. Uh, what you have to do is satata adhyayana, vadaha, discussion, paratantravalokana, tadvidyacharya sevacha. With the acharya you work, understand, and have a knowledge. With this presentation, I will conclude my presentation. I think we can have a discussion. It's a small topic, not a big topic. I have covered almost all the anorectal disorders. How
Yes, sir.
can we treat it? If you can have any discussion in it, I can. I am happy to answer any questions.
Okay, sir. First
Okay.
of all, on behalf of Ayurveda Map, let me thank you for this wonderful session, sir. Even though it is something like surgery is a place where we always fear to touch, but you have made this topic so you have presented this topic in such a way that now we are gaining confidence in treating such conditions, sir. So thank you for this wonderful session, sir. So, sir, with your permission, can we go for the discussion
Yeah.
part?
The only thing is in this these cases you should have your finger as yantra.
Right, right. Yes, sir.
Just utilize it. You can diagnose all the conditions.
Right, sir. Right.
Yeah, hastameva yantra alla, finger eva yantra.
Yes, right, right.
Yes.
Sir, before going into the questions based on this session, there is just two questions which was in the earlier session. Just I'll read out one question. 32-year male patient is known complaint of hiatus hernia, having hyperacidity with abdominal pain and experiencing sound from abdomen at night time. What will be the line of treatment and medication?
No, it's a udavartara chikitsa. Just you give Vaishwanara Churna with the Tapyadiloha is sufficient.
Okay, okay.
It's a udavarta with the ama is there. Gudu gudu shabda means it is ama. Ama yukta vata is there. Guda guda ata. In Ashtanga Sangraha, in
Okay.
Tika, he has told if you give just Vaishwanara Churna is sufficient. Such cases will improve, I can. Yeah.
Okay, sir.
Yes.
Sir, in case of regurgitation, which aushadha will be beneficial?
Eh?
Regurgitation.
Regurgitation.
Yes, sir.
Same chikitsa is sufficient. Udavartara chikitsa.
Udavartana.
Anuloma drugs you should give. And with the Amapachana. That is why Vishwanara I told.
Oh,
If there is no Ama, you can use Avipattikara Churna. Madhuragana Aushadhi.
okay, sir.
That is one is Madhuragana and one is with the Lavana. Vaishwanara is with the Lavana and Katurasas. Yeah.
Okay, sir.
Haritaki is there.
Okay, thank you, sir. Sir, we have one of our participants who wish to speak to you.
Yes.
Yes, Dr. Vaidya Vishwanath. You can speak now.
Sir, namaste, sir.
Namaste.
Sir, it was a wonderful presentation, sir. Thank you, sir. Sir, actually, I had one question, sir. One patient was there, sir. His prakriti is pitta, sir. So his complaints was there is an swelling around the anus, and sometimes it is painful defecation, sir. There is no bleeding while passing the motion, but there around the anus there is a complete swelling, sir.
Okay.
So how can we take this, sir? Is it
when it was started, pain, swelling?
Sir, actually 15 days back it was started, sir.
Yeah. Just you see, usually that conditions usually occurs due to thrombose to the external pipes. Usually by their this one food habits, thrombose external pipes comes with the severe pain with the swelling in around anus. Just to give him Jatya application with the hot seed bath with the lavana. By that they get relief. Then give Gandhagrasana and Triphala Gugulu. And if hard stool is there, some soft stool looseners like Isabgol or Herbalex or something should be given. Analomana Dravyas, Abhay Arista, this can be done. But the application of oil and Sirsupat is very important. By that it will reduce within 15 days. Okay.
Okay, sir. Sir. Sir, thank you, sir. Thank you very much, sir. Sir, one more patient is there, sir. Her patient age is 65 years, sir. She is having a constipation since 20 years, sir. So even after taking Anulomana tablets or some powders, Anulomana Dravyas, every day she used to pass the motion. It is like a hard stools. So with the forceful defecation only, then only she will pass the stools. And also she will be having a indigestion. Along with that, she had a history of asthma, sir. Shwasa is there, sir. For that also, she used to take some inhalers and all, sir.
Okay.
Nowadays, she stopped the inhaler. Since 1 year, she is taking some Ayurvedic Vasa powder. She is taking regularly. But constipation is not cleared. Even she took a Vyarista for 6 months continuously. It was suggested by some doctor, sir.
Yeah.
But now, 2 days before she came with these complaints, sir. So,
Yeah, but because of Rukshana, it's a hard stool. Give him Stigda. You can give Gritas. You
sir,
can give
actually,
Grita or Eranda Taila daily 1 teaspoon with the milk. Definitely she get relief.
sir. Which
Before
Gruta we
food,
can?
it should be given before food. That is in Apana Kala. Before food, it should be given for Apana Vai.
Sir, any particular Gruta can we select, sir?
You can use Changeriya Grita or Shatpala Grita or Panchagavya Grita. Because she is having Shwasa, you can use Panchagavya Grita also.
Okay, sir.
Or Eranda Taila can be given. 1 teaspoon of BD daily before food it can be given because the koshta become ruksha because of your tikta dravyas and also because of vyadhi also and because of age also. Everywhere it becomes ruksha. Make him her stigda and anulomana. Eranda Taila with milk is best drug. So if she feels Shwasa with that, you can give Eranda Taila with the Gomutra or Eranda Taila with hot water. Or you can give Grita, Panchagavya Grita. But it should be given before food. That's important. But 1 day, 2 day you can't get relief. After about 10-15 days, he start to get relief. Because when the koshta becomes Snigdha, slowly she becomes all.
Sir, after becoming Shuddha, sir, Koshta Shuddha, so her digestion will be corrected itself, or shall we add any other?
Definitely it will improve. You can use Vaishwanara Churnas if needed.
Okay, sir. Vaishwanara.
But Grita should be given.
Okay, sir. Sir.
Yeah. Grita or Eranda Taila, anything you can select.
Sir. Vaishwanara Churna with any particular Anupana, sir?
I think you give with the Grita only.
Grita. Okay.
Yeah.
Thank you very much, sir.
Okay. Thank you.
Thank you, sir. Sir, next question we have in the chat box is Agnimandya causes Malabandhada. Which kalpa we should use in Pitta Anubandha Agnimandya?
You can use Avipatika Churna. Avipatika Churna give. Yeah.
Sir, next question. Sir had one case of fissure. He was recommended surgery. He was given sitz bath, basti with murivenna, jatyadi taila for local application and internal medicines. But he had temporary relief. So can you please guide?
Pardon, what is the question?
Yes,
Surgery done, na?
He was recommended surgery. He was given sitz bath, basti with murivenna, jatyadi taila for local application and internal medicines. But he had temporary relief only.
Yeah. It will give only temporary relief. There is a central or hypertrophied anal papilla inside. Unless you remove it, it will be only temporary relief.
Okay.
That should be removed.
Okay.
Temporarily it will go.
Okay. Okay, sir. Next question. Sir, in chronic constipation in Arsha and old age and young age, in both cases, what should be the chikitsa?
Eh?
In chronic constipation in Arsha conditions,
Huh.
old age and young age, what chikitsa should be done?
I think Anulomana Chikitsa should be done with Abhaya Arishta and Vaishwana Churna, Gandhak Rasayan and Harite.
Okay.
That can be done only as a preventive aspect. If